talk to you about prolonged exposure therapy, which is one of the most effective treatments for treating post-traumatic stress disorder. But before we get started, let me talk to you a little bit about what PTSD is. PTSD is characterized by intrusive, re-experiencing symptoms, avoidance behaviors, and elevated arousal. In the absence of effective treatment, PTSD can become a chronic and disabling disorder that is frequently comorbid with major depression, other anxiety disorders, and substance abuse disorders, and is associated with a low quality of life. You may have seen references to PTSD in pop culture, often in reference to war.
Right. Stay back! Hey, stay back! All right. Hey!
You're a war hero, son.
I'm no fucking hero! I'm no fucking hero! You know what I've done?
Hey, it's all right.
Just relax.
Sam!
Huh? Sam!
Gun down, Sam! Down.
What are you gonna do? You gonna shoot me?
Hey, Chris. Babe. I'm going outside.
In reality, PTSD arises from the exposure to actual or threatened death, serious injury, or sexual violence, which means someone can develop PTSD following physical assault, child abuse, natural disasters, car accidents, witnessing death or violence, or many other situations. So, how do we go about treating PTSD? One evidence-based treatment is prolonged exposure therapy, or PE for short. PE's goal is to reduce the level of fear and anxiety connected with trauma reminders and reduce avoidance, anxiety, and fear when encountering a reminder. PE promotes emotional processing through deliberate, systematic confrontation with trauma-related stimuli. By having the client confront their fear without avoiding it, by dealing with their fear and anxiety, the client can learn that these feelings will lessen over time on their own. PE is usually paired with teaching the client different relaxation techniques. PE is based on emotional processing theory and includes elements from CBT and visual imagery behavior intervention. Principles include relaxation techniques, breathing exercises, visual imagery, and in vivo exposure. PE is generally conducted over 14 sessions, with sessions lasting between 30 and 45 minutes. PE involves repetition, which means telling the same story over and over and over again until the story becomes easier to tell. PE can be used with patients with PTSD, including direct survivors of trauma, rescue and recovery responders, and veterans, in settings such as private homes, the field and the community, and schools. Risk factors for clients with PTSD include increased drug and alcohol use, engaging in risky behaviors, disassociation, and inappropriate coping strategies. However, many protective factors may exist, such as resiliency, persistence, motivation to change, education, family support, access to mental health services, and employment. So let's talk about what the literature says about PE. PE has received the most empirical evidence for its efficacy. It has been shown to be highly effective for patients with a wide variety of traumatic experiences. Most importantly, PE is well tolerated by patients and does not cause long-term exacerbation of symptoms. Basically, it's the best!